No, this is the most important thing. Sports hernias are acquired. Origin insertion anatomy is garbage. Okay, quadricep extends the knee, hamstring flexes the knee, this muscle adducts, that's all crap. Okay, that never, ever, ever, ever happens unless you got a dead guy on a table and you can electrically stimulate his muscles. Like if you had a cadaver and you could lay him on his back on the table with his legs hanging off, like from the knees, and you stimulated his quad, boing, his leg would go sticking out. That's how we learn. So you've got to think about the effects, from a functional anatomical standpoint, you've got to understand what the body's doing to be able to understand this whole sports hernia.
So what is speed? Basically, it's the ability to move the body or parts of the body through required range of motion, very important, in the least amount of time with the maximum amount of force, okay? So I got a laser here. Two things, range of motion and force, you're going to hear a lot of today. Okay, very important factors in speed. We all possess speed to some degree, but most only use it a small percentage of it, okay? It's a learnable and teachable skill, okay, motor skill, which requires an organism to utilize their skeletal muscle, what? Effectively, okay? Effectively, very important what I'm going to talk about today. Key factors that affect speed, okay? Technique, arm action, leg action. Put this basketball, I know no one likes basketball here, I hope, because hockey guys traditionally don't. But I put this in here for Art because he's a basketball guy and he's putting on a hockey clinic. I was kind of confused with that. But
I don't know if you want to call it pet peeves or whatever. Like everybody talks about doing core training now and everything is functional. Depending on who you ask, pretty much any kind of training anywhere could be considered functional. In my opinion, doing Olympic-style lifts, squats, deadlifts, chin-ups, whatever, that is functional training. No weight belts. So you got to have good core, transverse abdominis, all this kind of stuff. If you can't lift it without the belt, if you can't squat it without the belt or whatever, then it's too much. And a thing I said here at the bottom, weights are resistance to our bodies. The movement is more important than the weight. So we're going to master the exercises first, then we use barbells and dumbbells to add resistance to our body. Again, it's not about moving the weights, it's about moving yourself.
It's a very physical sport that's played at high speeds. So how do we make our athletes better from a strength conditioning coach's perspective? The biggest role that we can play is to help our athletes by reducing the chance of injury, as well as improving the qualities that they need to better play their sport. Strength, power, speed, agility, conditioning, coordination, and flexibility, etc. My philosophy of training is that everything should be done in an effort to increase the athlete's ability to absorb force or decelerate. Okay, so my goals today are to share with you how I organize my off-season training program and then put in the different areas of training that are going to be the most important, and also show you different drills, exercises, and progressions that I've used with my hockey athletes.
A little bit of my background. I've worked as a strength and conditioning coach, as a certified athletic trainer, physical therapist, as well as a professor, and I'm still practicing physical therapist. So I respect and really understand the importance and need for all professions, and I can see how each and every profession really needs to work together. At Northeastern, we did a screening, and then instead of just doing a total team approach, we identified approximately 5 individuals that had significant limitations and thereby gave them individual programs. I think one of the worst things you could do is throw everybody all together, especially with deficits and or problems, into a whole team approach and just kind of nail somebody. It could be an overuse situation. An understanding of the anatomy, kinesiology, physiology, biomechanics, not only of the sport but of the position. The functional demands of a goalie will be different than a defenseman versus an offensive person. The key here, I think, with injury prevention is screening each individual athlete. And it's really difficult as an athletic trainer or a physical therapist or strength coach to do this, mainly because of time concerns. I've worked injury prevention at Penn State programs, at University of Connecticut, now here at Northeastern University. And what seems to really work well is getting a team approach and getting the coach on board, the strength coach on board, the athletic trainer, and working as a team. I think if you try to do this just by yourself, could be problematic.
Patients with impingement present. The main presentation is pain, and usually this pain is anterior. So they say it's sort of deep in the groin, so deep in the front of the hip. Occasionally, they may have a lateral component referred or posterior component referred. We call it a C sign when they make their hand like a C and they go all the way around the hip. That's not uncommon impingement as well. Return to sports is usually somewhere around 3 months to 4 months, but can be as long as 6 months after surgery, depending on how much was done. Normal anatomy, but if you tilt your pelvis, you've got the same thing going on as pincer impingement, and if you can learn to tilt your pelvis the other way, you can get rid of the pincer impingement, probably like the glenohumeral joint, where we focus on scapular dynamics when you'd be focusing on the pelvic dynamics as well.
Stiffness. Here's a word we've heard today. or this weekend actually. It's the ratio of force change to length change. So if you put in a lot of force and it doesn't move, that's a stiff muscle, stiff segment, stiff joint. The other thing I gotta say is this is where physio becomes an art, not necessarily a science. You're gonna say, well, that guy's full of crap, and that, you know, that doesn't exist, and that's not an issue. And you might be right, but with the people that I see that are injured, that are broken down, that can't get better for months, this is some of the things we see that are issues.